So here in Texas, we have actually seen the ACA really work for us. Over the last 3 years, since 2013, we've seen a large reduction in our uninsured rate. We started at a very high rate of 22.1% of Texans being uninsured, and we've seen that drastically reduced to 16.6% with a little bit of reduction every year. And we want to see that trend continue. Now, in Texas, as many of you know, we didn't expand Medicaid. So when we look at why our uninsured rate is going down, the primary driver of that is opportunity to enroll in the health insurance marketplace. And last year, to give you some numbers for what we've seen in our marketplace, last year 1.2 million Texans selected a plan in the health insurance marketplace. And so throughout the year, people come in and out. At any given time in the year, you've probably got about 1 million Texans who are using the opportunity at the ACA marketplace to enroll in coverage. So while we've got the ACA really working here and we've got opportunities to make it work better, for example, by expanding Medicaid and opening up the opportunity to get coverage to another 1 million Texans, we also, as everyone knows, we had a new administration come in this year, and an administration that has largely been very against the Affordable Care Act and has openly admitted to sabotaging the Affordable Care Act in many ways. And so this, as they set up these sabotage efforts, and there are many, and we're going to talk about them, the idea is for us to hold them accountable for those efforts, but also to counteract them in whatever ways we can. I'm under no delusion that that we can fully counteract those efforts, but we want very much to make as big of impact as we can to still keep the opportunity for coverage available to Texans. Okay, so the biggest and most recent hit when it comes to sabotage of the Affordable Care Act and this upcoming open enrollment came at the end of August. And this is when the Trump administration announced 2 things. First, they said they were going to cut advertising and outreach from $100 million to a mere $10 million. That is cutting the outreach budget to the bone. One of the things that I often cite for people to understand how large of an impact this is that California actually has their own state-based marketplace for their entire state. And they plan on spending $110 million just for their state. So if you compare that to the $10 million that is going to be spent for all of the federally facilitated marketplaces, and that's about 30, more than 30, then you can see that this will mean very little when it comes to actual impact to outreach and enroll people. And what we've heard from our DC partners is that this is actually only going to support the emailing campaign that would go to current enrollees. So they'll be emailed to reminders on that they need to renew. This will not include any outreach to people who aren't already in the system or maybe were in the system before but fell back out. It will only include those current enrollees. So we've got a huge hole that's been created by the administration as far as advertising and outreach. Then the second piece is that we have in-person assisters throughout the state of Texas and in all states that have a federally facilitated exchange called navigators. And these navigators, there are actually several different terms for people who do enrollment assistance, but the navigator term is specifically linked to organizations who receive federal funding through a grant to perform this work. And this is actually required, the existence of navigators is required under the Affordable Care Act, but there is no requirement for the level at which they should be funded. So seeing an opportunity for further sabotage, the administration cut those funds from the navigators at about 41% when you look at the U.S. overall. So that's from 63 million to 36 million nationwide. Now in Texas, what happened here is we actually have about 10 organizations that receive navigator funding. I want to point out that many of those organizations get large amounts that are then subgranted to other organizations. So it's not, so many more than just 10 organizations participate in the Navigator program here in Texas. But those grants here in Texas, we saw about a third of our funds were cut. So we went from about 9 million to about 6 million. But that's the overall average number. There were actually navigators within those specific organizations that saw cuts of more than 50%. So there are certain areas of the state, particularly Houston, the Panhandle, and East Texas, where the navigator funds were cut so drastically that it will be very difficult for them to continue to provide the service at the level that they were able to provide it before. But as a reminder, while this is our biggest and most recent sabotage effort from the administration, it is one in a series of efforts. And so I think it's important to continually remind folks that when you're saying things like the Affordable Care Act isn't working, premiums are too high, then there is a question of, well, what's being done that erodes that stability of the market, and who's doing it, you know? So reminding them that there is actually a very easily tracked series of efforts by the administration to undermine the law. So I want to go through a few of those. So we talked about the Navigator grants getting cut by 40%, but there are also these additional contracts that went to specific entities here in Texas. Those entities were called SRA and Cognosante. And they actually had contracts in 18 cities across the U.S., 6 of those cities in Texas. They were actually canceled altogether. And it's important to highlight this because those were not small contracts. And in fact, in some of our larger areas, like in Houston, they had a substantial amount of full-time employees doing enrollment, and they were chosen specifically because they could target vulnerable populations. So I know here in Houston, they had very specific language skills within their enrollment assisters, and were able to handle some of the complex cases for certain immigrant families when they have a more complex immigration status. And so we, as a coalition, often referred to them in order to handle those more specific cases. So that was a real blow to Texas overall when those contracts were canceled, because we had so many cities depending on those contracts. Now, of course, on top of less funding for advertising and for enrollment assistance, we also just have a shorter time period. So the administration did final rules in the late spring that shortened the enrollment period to a mere 6 weeks. In previous years, we actually had a full 3 months of enrollment. So enrollment would have started on November 1st and ended on January 31st. And then a few other things that we're not going to spend a whole lot of time on today, but it's important to remember that they're part of these efforts. There is indication through an executive order that there will be relaxed enforcement of the individual mandates. So that's that fine that people might have to pay on their taxes if they don't get coverage. That's the stick. You know, got carrots, which are financial help, but our stick to get people enrolled in coverage is that fine. And when you take that away, your young and healthy people are a lot less likely to enroll, and that could really increase your premiums. We also don't have long-term commitments from either the Trump administration or from Congress on funding what are known as cost-sharing reductions. If you don't know what that is right now, that's okay. We're going to actually talk about those in detail, but those are things that make using your coverage more affordable by reducing your out-of-pocket costs. So we don't have have a long-term commitment on funding those from the government. And then I don't want to go into specifics on these regulations, but you will get these slides, and there's a link to my blog. But there were also additional regulations that came out in the end of the spring that made some minor tweaks to the marketplace, but all of those tweaks really were not beneficial to the consumer, but instead beneficial to health plans, and to really just was like a wish list from the major insurers, but at the expense of consumers. So now that we've sort of set a stage here for this is the environment we live in. We've got an uphill battle and we're going to need to get the word out. But in order for people to be effective communicators about the ACA, we thought it was important that we go over some basics. So first, and I know that for some of you, in fact, I know that there's some people on here that get ACA coverage. I've seen your names, and I know you personally. I know you get ACA coverage. So this might be a little bit too high level for you, but bear with us. We're trying to get everybody on an even playing field, so when we talk about messaging, it makes more sense. So first, the marketplace is a place where people can go get health insurance coverage when they don't have access to health insurance coverage through their job. So it's often referred to as the individual market because it's an individual buying a plan as opposed to like employer-based coverage where it's an entire group of people under an employer buying a plan. But a place for people to go shop for coverage when they don't get it through their job. Like coverage from a job, there is only one time a year when people can enroll unless they have some life event that allows them to enroll outside of that time period. So that open enrollment season, as we call it, happens this year from November 1st through December 15th. It's really important that everybody remember those dates, because if we can get the community to remember those dates, that would be that'd be a win in and of itself. Now, in order to sign up through the for coverage, most people use the website. It was designed to push people toward the website, but you can also call into their call center. And for those people who want that extra help, and we actually will talk about how useful it is to get extra help when you're enrolling, there are local enrollment assisters who will sit with you and help you through the online application. So those are sort of the high-level basics of the marketplace. Now let's talk about what you can actually get. Who's actually eligible for the marketplace? So if you just want to buy coverage, then the people who actually can go on to healthcare.gov and buy coverage is anyone who's a U.S. citizen, or what I'm referring to here is a legal resident. But to clarify, that's really anyone who is here legally on a longer-term visa. So, for example, not necessarily a visitor's visa, but student visas count. Anybody here that's living here as a resident in the United States legally. I have one asterisk there. DACA recipients are not actually don't actually fall under the definition of lawfully present, which is what's used for the marketplace. That's because it was passed after the Affordable Care Act. As you all very well know, it's very controversial, and it was never folded into the definition. So DACA recipients are also not eligible to purchase marketplace coverage. And then, of course, you can't be incarcerated. If you're incarcerated, you can't purchase coverage. So that's who can go and purchase full price plans. Now, if you want help with your premiums, so that's that monthly cost that you pay, anybody between 100% of the federal poverty level, and I'll give you specific numbers on what that really means, and 400% of the federal poverty level, they can get help with reducing those monthly premium costs. And then a smaller subset will get that help with the premium costs, but they will also get help with out-of-pocket costs. And this is what we call the cost-sharing reductions. But again, just things that lower your deductible, lower your co-pays when you go see a specialist, or lower your hospital bill when you go to the hospital. And we'll give some specifics on that as well. But anyone between the poverty line, so 100% of the poverty level, and 250% of the poverty line gets access to those in addition to access to the premium assistance. Now, I want to warn everyone, my next slide is pretty complicated, but I'm going to pull out an arrow to walk you through it. And really, what I want everyone to take away from this slide is that the Affordable Care Act's major goal was to create what I refer to as a continuum of coverage. So if I'm a person who makes less than $400,000, or excuse me, 400% of the federal poverty level, so that's about $82,000 a year for a family of 3. If I make less than that, then I should be getting help from some program with paying for my insurance. So now we know that there are gaps in this coverage that were created because the Supreme Court made Medicaid expansion not mandatory, and states like Texas did not expand them. But let's start with kids just to give you a sense of what it should have looked like if we had actually expanded, what it should have looked like, in that there's a complete continuum of coverage. So kids all the way up to 138 of the FPL can get Medicaid. CHIP sits on top of the shoulders of Medicaid. And so kids all the way up to 206% can get CHIP. If you're above that amount and you need coverage because you don't get it through your job, then you can go to the marketplace. And there's this sort of ugly yellow color. These are people who get both the premium assistance and the cost sharing reductions. And then above 250% of the FPL, we've got all the people who can get the premiums. Now, I don't want to spend too much more time on this slide, but we do have our U.S. citizens and what we refer to as Medicaid eligible immigrants. This is a very small subset of immigrants, primarily refugees, who are treated like citizens when it comes to eligibility for Medicaid here in Texas. So now these people actually fall into the coverage gap. There's a little bit of Medicaid, and this should actually be even tinier than it is because it's such a low income threshold. But there's a little bit of Medicaid available for very, very, very low income parents. But then we've got our Medicaid coverage gap. These people don't have access to anything. We don't have time on today's webinar to talk about the Medicaid coverage gap, but it is something that the center has a lot of materials on if people are interested. Above the poverty line, these individuals can access the marketplace, both with the cost sharing reductions in premium payments and then just the premium payments. Now, what's an interesting thing to point out here is that most people who are here legally, so what we're referring to as legal resident adults that are not considered Medicaid eligible, so not people who are refugees, for example, they actually have access to the marketplace all the way down to zero income. And again, I want to move on to the next slide, but the reason for that is even if we'd expanded Medicaid, because of Texas's rules on how immigrants can and can't access Medicaid, even if we expanded Medicaid, they wouldn't have been eligible. And when they wrote the ACA, they knew that was true for us and 5 other states. So in those states, people who are here legally, so considered lawfully present, can actually access the marketplace all the way down to zero income. And if you have more questions about immigrants, the center actually does have we've got a really great report that we put out last year about access to healthcare for immigrants that I'm happy to share with folks. Okay, so now that we've kind of talked about who's eligible for this assistance, let's talk about how helpful this assistance is. Really, for those individuals who can access the assistance, it really does make health insurance affordable. So we've got a few numbers here, and these are actually straight from 2017 as reported by CMS. So these first 2 numbers, the average monthly premium before the tax credit, so that's before those premium subsidies, and then the average monthly premium after the tax credit. These are if you take every single person who bought a plan in the marketplace and average their costs together. That's what you get. So about $404 a month in a premium before the tax credit, but that goes down to $130 a month after the tax credit. But that's if you take everybody. And 83% of people who purchase coverage on the marketplace are actually eligible for those premium subsidies. And if we only look at that subset, and we only look at that 83%, then the average premium was only $85. And those are actual numbers. So we're going to sort of tie some of this information to those best practices and messaging so that you have some numbers to sort of back up when you tell people marketplace coverage is still affordable for most people. You can tell them specific numbers. Like last year, for 83% of the people, those people who had access to premiums, they paid less than $100. It's important to understand how that premium assistance works. And I know this is a lot of information on this slide, but very basically what it's trying to show you is that even as the cost of insurance goes up with age, the premium assistance is actually tied to your income. So no matter what your age is, if you only make $15,000 a year, then you're only expected to pay out of $26 per month out of pocket. So the difference between the cost of that premium and that $26 is going to be your tax credit. And that tax credit is adjusted based on your income. So what that actually means is that as premiums rise, either because maybe you're older or because we see an increase in premiums because of market instability, those people who get the tax credits are actually still shielded from those premium increases. And that's really important to remember. Another big piece of the market that gets maybe a little less attention nowadays just because we're so focused on the premiums and the stability and the politics is that the marketplace was actually the first time an individual could go to one place and compare plans across insurers. The original concept for the marketplace was that it would be like the Priceline of shopping for health insurance. And that was really needed because, like everybody knows, insurance is complicated. So it is important that they create a system where people could compare and get a sense of what the plan is actually going to offer you. So that system that they created are these what we call metal tiers. So we've got bronze plans, silver plans, gold plans, and platinum plans. And what's really important to note in these is that for what's associated with it is how much that plan is actually going to cover of your actual healthcare costs when you go to use it. So the bronze plan covers 60% of your costs, silver is 70%, gold is 80%, and platinum is 90%. Now, as you see, as they cover more of your costs when you actually get care, it gets more expensive monthly. But this is a good way for people to get a sense of knowing exactly what they're paying for. So let's talk a little bit, let's take a step deeper into cost sharing reductions so that we make sure everybody sort of understands it. And really the takeaway I want everybody to bring from this slide, and I try to put that always in the title, is that if you're telling someone about the health insurance marketplace, encourage them to consider a silver level plan. And here's why. We talked earlier that a certain subset, so those people below 250% of the federal poverty level, have access to those cost-sharing reductions. They reduce the cost of your out-of-pocket expenses. So as you can see here, they reduce the cost of your deductibles or maybe your out-of-pocket limit, or if you go to the hospital, or if you have a copay for a physician. But you only get access to those cost-sharing reductions if you purchase a silver level plan. So that's why we push the silver level. And what's very interesting is the amount you get in the cost sharing is actually staggered. So the lower income you are, the more cost sharing reduction you're going to get. So over here, you'll see this lowest income bracket, and that's from 150% of the federal poverty level down to 100%. They actually get 94% of their health, when they use their coverage, 94% of it is covered. So that's very generous. And when you're talking to people, you can highlight, if you're in this income bracket, you're actually paying for a silver level plan, but you're getting something that's better than a platinum plan. So this is a way to get a platinum plan for the price of a silver. And you get pretty close to the platinum level coverage for those below 200%. And then with between 200 and 250, it is less generous, but still helpful in lowering those out-of-pocket costs. Now, I know many of you are probably thinking, but I heard and you just talked about they're not going to fund them. Well, when we talk as advocates, and I think it's important for us to remind ourselves that we'll have two different hats throughout this fight. One for when I'm calling my senator or my representative to talk to them about what we need. And then one when I'm talking to a consumer, because there are different things that you should be highlighting and considering when you're wearing those two different hats. So yes, there is a question as to whether the Congress or the Trump administration will continue to fund CSRs. And I think that has gotten even more, the closer and closer and closer we get to open enrollment, I think it's become very stressful for advocates. It looks, more and more like they won't fund them. But even if they don't fund them, the health plans by law are required to provide silver plans that have those cost sharing reductions built into them. So for a consumer, when you're talking to a consumer, you should encourage them, you're still going to get your cost sharing because it's required by law. Now, what does that actually mean for the market? It's not good for the market, and that's why we have to keep calling our representatives and letting them know this is an important thing for market stability. Because if they're not funded, we will see insurance companies pull out of the marketplace. We've already seen some of that occur. And we've also already seen premium increases for this year. We did have rate filings. We have seen increases in Texas. And much of that is attributed to the fact that if the insurers are still on the hook for the cost sharing reductions, then they've got to make up that cost somewhere, and they do that by increasing the premium. But I want to keep hammering home this point that premium subsidies generally shield those people who are eligible for them from premium increases. So it's really important, again, consumer messaging. We don't want the premiums to go up in the market. We want those premiums to stay stable so everybody has access to affordable care. But when you are talking to consumers, reassuring them that they're protected from those premium increases can be really powerful for them. So I want to, before we go on to consumer messaging, I'm going to take a few quick seconds to look at some questions to see what may have come in. So we've got Daniel Bouton, and I'm just going to give a shout out to him. He runs the Navigator program for this huge area in Northeast Texas that includes Dallas-Fort Worth. So thank you, Daniel, for joining our call today. And he wanted to point out that there is a new organization called the National Association for Health Access Assisters that has been created, and it was created by a couple of my colleagues that work in DC who do similar work for me, and it's there to support those Navigator groups and other enrollment assisters. And he wanted to give a shout out to them to let people know that that work is happening and to support that work. And thank you, Daniel, for joining, and thank you for pointing that out. That's great stuff. And then we had a question from Nancy Dela Cruz asking about a list of the Texas grantees who lost funds. So that has been made public. You'll see several news outlets who have covered it here in Texas. I know there was a story in the Chronicle. I know there was a story in Bryant College Station, and I know there was a story in Austin, all about those that gave specific, sort of a specific regional perspective for those cuts. But it was also published in Medium. So that is the only place that I am aware of right now that has the full list of the Navigator cuts. And so Nancy, I will follow up with you directly to provide that. I will emphasize that the administration has actually not made those final grant amounts public, and it is unclear whether they ever will. But it has been leaked on the internet, so it is sort of available to the public through the internet. Okay, so we've got a couple more questions that we'll take now before we move on to the consumer messaging. So Anthony asked, if the government ends up paying the CSRs and insurance companies' earnings go up as a result of charging for them through premiums, do the insurance companies have to refund a portion of the premium payments? I think that's a really good question, Anthony. And what I propose doing, I should have your contact information as you registered through the webinar, is I would like to run that through my colleague, Stacey Pogue, who would be the expert on exactly how that might work, and we will get you an answer. So the answer is I'm not sure. I have not heard that would be the case, but I do think it's an important question to ask. And then we have a question from Virginia Garza. Will people have a problem finding doctors that accept the ACA? And so to answer that question, I think it depends on where you live. And we definitely, since the beginning of the Affordable Care Act, there has been some pushback, especially in more conservative states like Texas, from doctors actually accepting the ACA insurance and being part of their networks. And we haven't actually talked about this year because the focus has been more on just letting people know it's still there. But I do encourage everyone to take a look at the plans that are available in your area, and they do have to keep their provider networks updated in their provider directories. And I think going to an enrollment assister is actually maybe one of the best ways to get a sense of and bring your doctor's name with you. So this is something if you're telling people get enrolled, one of the things to do is make sure before you go to an appointment that you've got all your ducks in a row and you know your doctor's name, and they can help you find a plan with your doctor in that plan. That's what the enrollment assisters, especially, they are so very familiar with the plans in their area and exactly how to find a plan that meets the health needs of the consumer, but also those doctors. So I don't anticipate that it's going to get worse as far as the network adequacy, but it's important to highlight that it's always been a little bit of a struggle just because of some reluctance in conservative areas to fully embrace the Affordable Care Act. And I do wish that was something that Congress was actually working on to improve network adequacy rather than just not working on things that actually improve the market. So we've got one question here, Ben Gold. Could you discuss what someone without credentials can and cannot discuss with people trying to enroll? Also, I understand health insurance brokers can sign people up. What's the difference between brokers and navigator capabilities? So the navigators and brokers actually have a very similar, they have a very similar role. I will say, I will say that that brokers are still getting commission from certain insurance programs. So there may be a broker who might push someone toward an insurance program. But I work with brokers and I work with assisters, and I have worked with a great deal of good brokers who really do care to get their consumers enrolled in coverage. And quite frankly, at this point, there is a reduction in capacity for the assisters because of the reduction in navigator funding. So yes, I definitely think that finding a trustworthy broker is an important thing to do. There are a few sort of red flags when finding a broker. If they're charging you for that enrollment, which they are allowed to do under Texas law, I would find a different broker. They get commission. They shouldn't be charging you. And quite frankly, there's good expertise as far as free assistance that is available to people through the navigators or other brokers that don't charge. So I think that that's a really good. But brokers and navigators have very similar roles. As far as help. We could talk more about what a person without credentials can do, but quite honestly, this is you don't necessarily need to be credentialed to help your family or friends enroll in coverage. In fact, it happens all the time. We see it in the research, especially for those those young invincibles that were trying to get into the market, you know who they call when they need to help enroll? They call mom, and mom helps them enroll. But if you are an individual who would actually like to help people enroll, there are some opportunities to do so, and you can get credentialed as what's referred to as a certified application counselor. And we're going to talk a little bit more about that as we move forward. So I'm going to go ahead and move us forward because we are running close on time, but I do hope that answered everyone's questions for now. Okay, so let's talk about consumer messaging. We've worked here in the Cover Texas Now Coalition, and based on research that was previously done by organizations doing this work like Enroll America. They no longer exist as an organization, but their documents are still out there, and we're still trying to use their great consumer research. So through a combination of those efforts, these are the top 5 messages that sort of we felt like would be the most important to get out into the community given where we are this year with the Affordable Care Act. So I'm just going to read through them, but then we're going to dive into each of them deeply. So the ACA is still here for you. Financial help is available to lower monthly costs. Don't wait. Open enrollment is only November 1st through December 15th. If you don't enroll by the deadline, you may have to pay a fine, and free in-person enrollment help is available. So let's dive into each one of those. First off, it is so important just to let people know that the ACA is still here. We saw, even just a few days after the election, enrollment assisters across Texas were started to get phone calls from consumers saying, what's going to happen to my coverage? And then we even had we heard some consumers saying, well, it was Obamacare, so Obama's not in office anymore, so it's gone. Because, you know, it's not a hard leap to make. And then, of course, anyone, even if you are maybe keeping up more with the congressional activities, it got intense and very confusing. There were multiple efforts to repeal the ACA over the summer. So those who aren't, you know, policy wonks like myself constantly following Andy Slavitt on Twitter may not know where we are right now with respect to the Affordable Care Act. So it's very important to reiterate, no, the ACA is still here, it's still happening, and you can still get coverage that's affordable to you. And of course, reminding them of the enrollment dates. So that's sort of the top line thing. If we can just help consumers understand that the ACA hasn't gone away, I think that that's really essential. The number one reason when you poll uninsured folks on why do you remain uninsured, the number one reason, of course, is that they feel that insurance costs too much and therefore is unaffordable for them. And for many, that is very, very well may be true. However, it is important to note, and this is actually some numbers that came out of the Commonwealth Fund, that 40% of the uninsured don't know the marketplace exists, and 50% don't know financial help is available through the marketplace. So this just sort of highlights the need to continue to get the word out that the marketplace is here, that even with all of the political news media focusing on the ACA, that doesn't always translate to consumers understanding how it impacts them and what options they have. So the cost being your biggest barrier, highlighting the financial help is really essential. And it's essential to do it in real terms so that people know that the deduction is very affordable for most individuals. So you might say, you know, if Nancy selected this plan and it was $328 a month, but then when she got her premium, her financial help, it actually was only $85 a month out of pocket. And we talked a little bit earlier about saying things like most people can get coverage for $100 or less. And that's absolutely true. The statistics that we have for Texas show that 83% who get the cost sharing or the premium help, they paid an average of $85 a month for their premiums. It's essential to continue to hammer home the dates for open enrollment this year, reminding people that it's only 6 weeks long. If they've signed up in years past, they might think they have till the end of January to get enrolled. And we know that people often wait till the last minute to get enrolled. So even if they know it's December 15th, maybe it's December 10th and they're like, oh, I've got 5 more days. But to remind people that the closer you get to that deadline, the more strain there is on the system, both from a perspective of enrollment assisters having more people coming in their doors, but then also just the website itself having more strain as more people try to enroll. So getting signed up early would be the easiest way to make sure that you get in the door and that you get all of your enrollment taken care of with a minimal amount of effort. I want to highlight that, as many of you may know, there is extra time for areas impacted by Harvey. And I don't want to go into the specifics here, but I can tell you it is most of the major metropolitan areas in the Gulf Coast. So, of course, all of the FEMA areas that were identified for individual impact, but then there's also a few areas where they were identified as eligible for public assistance. So they actually get a couple of extra weeks as well. And so there's more information on my blog about this, but very basically, they'll get until December 31st to enroll. However, we, as a statewide campaign, will continue to push the December 15th deadline, and then as we get closer to the end of the enrollment period, then highlight the additional 2-week opportunity. We really do feel like getting in before the 15th is essential for a couple of reasons. You have to get enrolled by the 15th if you want your coverage to start January 1st, and December 15th onward, you're getting closer and closer to the Christmas season, where people, it really is often the slowest couple of weeks in previous years, and it's just because people are busy with the holidays. So it's really, you know, the message we want is get everything done before the holidays and get in and enroll before the 15th. So in years past, it has been motivational to make sure to highlight that there is still a fine associated with not having insurance if you can afford it. So if you don't enroll by the deadline, again, reiterating that the deadline is key, that you may have to pay a fine. And Enroll America did research on the use of the word fine versus penalty or fee, and fine resonated the most with consumers, so that's what we try to use. So a few ways to reiterate this to people: if you don't get coverage, you may have to pay a fine of $695 per person, or 2.5% of your income, whichever is greater. You know, that's a pretty big chunk of change. And reminding people that if you pay the fine, you're actually paying something for nothing, when you could just buy coverage. And if you're eligible for health, it could be $85 a month for actual health coverage. So sort of comparing the numbers so that people understand the financial impact to them. I know that we mentioned earlier that based on executive orders from the Trump administration, they do seem to indicate a relaxed enforcement of the fine, but I did post some verbiage here to let you know that the IRS still intends to enforce the penalty, because it is still the law, and that's directly off the IRS website. And then finally, free in-person enrollment help is available. So 71% of the remaining uninsured want to talk to somebody before they enroll in a plan. And of those who actually do get enrollment assistance, they're 60% more likely to successfully enroll. So we talk about this as in-person enrollment help, and we often highlight that it's available in your local community, so that they know they don't have to necessarily have to drive very far to get to it. Now, that's not always true in Texas. We have a big rural population, but there are navigators throughout the state and CAC organizations throughout the state that can help people enroll. So to highlight that, I sort of listed those, how to connect with an enrollment assister. I think even if this webinar is the only thing you watch on this issue, it's important to know that if somebody asks you, how do I find out more about the ACA, they can go to either the Get Covered connector, and everybody will get these links, or local help at healthcare.gov. Both of those places will help you find local assistance in your community that you can then make an appointment with them and come in and do enrollment assistance. The Get Covered connector, it does not cover all of the areas of Texas, but it is used very heavily in many of the major metropolitan areas, and you can actually make your appointment right there online. So if you say, I want to get an appointment at 10 o'clock on Saturday, then you can make that appointment and schedule it, and it'll give you text messages to remind you, just like getting your appointment with your hairstylist. I've also listed out all the enrollment coalitions throughout the state, so the Enroll Gulf Coast, Enroll San Antonio, all of the ones throughout the state that if you Google these, you'll find a website. The Community Council of Greater Dallas is our big navigator. As I mentioned, Daniel Bouton is the lead there, and so you can go to their website to find their assisters. And then the South Plains Community Action Association, that is the big assister in the Panhandle area as well. So those are assisters that are available throughout the state. If you don't see your area listed here, you can always reach out to me, and we'll make sure to figure out who's closest to you so that you know who you can refer people to. Okay, we're going to go through some tough questions, and I'm sorry that I'm having to rush a little bit here at the end, but I think it's important that people hear these things. And I actually see these on Facebook. I get them in person. I hear these tough questions all the time. So why should I get covered? They're just going to repeal it anyway. Again, we just go right back to our talking points. The ACA, Congress hasn't repealed the ACA. It's still a law, and it's still here for you, meaning that the affordable coverage is still available for those who qualify. And if you can afford coverage and you choose not to, you may get that fine on your taxes. So again, just reiterating that get in while the getting's good, because we can't say what Congress is going to do, but we do know the ACA is here right now, and we do know it'll be here for 2018. I hear this all the time. I heard premiums are going up again, this year, and plans aren't affordable. This is where we sort of pivot back to that idea of, yes, premiums are going up. That's bad. We want Congress to fix it. But we need to remember that most people are eligible for financial assistance, and when premiums go up, so does the financial assistance. So most people are shielded from the premium increases and can still get affordable coverage. I pivot back to that all the time, and it's important that people continue to remember that, because that's the consumer message. Again, when you're calling your legislator, you should still be hounding them for marketplace stability so that premiums don't continue to go up, because we want the ACA to be affordable to everybody, not just those eligible for those subsidies. But this is the reality we're living in right now, is those subsidies really do help keep the cost down. And then finally, sometimes I do get this, and I actually saw this for a few people who posted this webinar on the Facebook page. I saw some people comment in the comment section in this way, saying like, well, I had an Obamacare plan and it was barely affordable, and it might as well be called the Unaffordable Care Act. And I think it's important to acknowledge the pain of those individuals. There is absolutely a section of people who don't get coverage through their employer, but they make too much to get access to those subsidies. That's about 17% of people in Texas. And that's bad. We would like for them to have affordable coverage, and we would advocate to Congress to fix that by providing more financial help and stabilizing the market to reduce premiums. But it's important to then always pivot to, but remember, those who do qualify for help, the insurance is largely affordable, and they can get a plan for less than $100 a month. So I think it's important to acknowledge that, yes, it doesn't work for everybody. It's not a perfect law. We need to improve it, but it is working really well for a lot of people. So let's talk about how you can help. First, if you haven't already, we've got a volunteer sign-up form, and it's linked in the presentation. You're going to get the presentation after this. So this will capture your name and where you live and your level of interest. And let's talk a little bit about what we're actually looking for in volunteers. So first, just being a social media amplifier. So going online and amplifying the message on social media. If you sign up on our volunteer sign-up form, you'll actually get a weekly email that will include sample tweets, sample Facebook posts with graphics. The idea is to make it easy, plug and play. I copy paste it into my Twitter, copy paste it into my Facebook, attach the graphics, and I'm able to blast out my message every week. Let's say you want to get a little bit, you want to roll up your sleeves a little bit and get involved in your community. Well, we'll also be creating a toolkit that you can use, and it's sort of a DIY outreach toolkit for anybody to take and then use it in their community. There'll be a flyer that's included in there and all of the social media graphics. And the idea is that you can take that toolkit and you can be an enrollment champion in your community and use it however makes the most sense for you, or maybe if you're working with a group of people that want to do this work, you can use it that way. And we'll be providing that it should be done in the next week or so. And then if you really want to interact with other people doing this work in the community, we are working with enrollment coalitions across the state, like the ones that we listed, to identify volunteer opportunities. And if you identify that you want to do something like that on our volunteer sign-up form, we will then send your name to your local enrollment coalition and let them know, hey, here's some people who are interested in helping you, and they'll get you looped in through their volunteer process. So an example of that is Enroll SA in San Antonio actually already has their volunteer process set up. They're looking to do volunteer training up until November 1st, and then they'll be using their volunteers for outreach and phone banking. So those are some opportunities you might see there. In Austin, they're actually looking for people who want to go get trained, do this 6-hour class at night, and become certified application counselors. And then you get to actually, have the joy of helping a person enroll in coverage maybe for the first time ever. And that can be a really rewarding experience. So we'll talk more. We'll contact you if you fill out that form to let you know what's available in your local community and get you connected to those people. Or if you and everybody will get the resources, so everybody has those to use themselves. We're a little bit over time, but I have a couple of questions that I want to make sure to get to. Cecilia Harrison actually asked for the fine for children, and Cecilia, I will just look that up for you and send it back to you specifically because I want to make sure that I get that number exactly right. And then Anthony asks, given the sabotage of the website, is it possible to develop something that works around the website, hard copy enrollment, or a system to collect the data and then rapidly enter it onto the website? There are some additional options to get enrolled if the website does crash. One thing that's kind of a fun workaround that we've seen work a lot in the past, especially if you're in Texas, because we have such a large Spanish-speaking population, is often healthcare.gov might go down, but the Spanish language website doesn't go down. So, for those Spanish speakers or people who are bilingual, they might start using the Spanish language website. That's a fun workaround. But yes, there are ways to enroll people on paper that it comes with its own problems in that you can't verify information in real time the way you can on the website. It can take a lot longer to get that enrollment in, but there are some workarounds, and we'll be working with the enrollment coalitions to figure out what to do in the event that the website does crash. I will say that the first open enrollment period, we had a lot of problems with the website. Nobody's hiding that fact. And those organizations on the ground figured out ways to make sure people still got enrolled. It may have taken longer than they wanted to, but they still did get them enrolled. And I think that we'll work through the problems as they come. It's kind of hard to anticipate what they are. And then there's also if brokers, I don't love the web broker system. There's some problems with it as well, again, related to verification of information. But there are allowances for brokers to use what are called web brokers. And what they basically do is they have their own internet portal that sort of connects to the back end of healthcare.gov, and you can get people in that way as well. And so that might be something we may end up having to partner with brokers in certain areas if if it gets to a point where the website is just completely unusable. But again, I think we have to sort of respond to that in real time and see, how good or bad the website will be maintained this season. And then there's a question about maintenance. The maintenance that's going to be occurring every Sunday for healthcare.gov. Yes, that is 100% true. That was announced on a webinar that was hosted by CMS. It was announced very broadly. So I know that there's a lot of people who are skeptical about that because it seems so unreal for it to be down for 12 hours at a time once a week on Sunday morning. But it is 100% true, and that is something that advocates are pointing to as a potentially unnecessary step for the administration to have taken. I am not an IT expert, but people who have said that it seemed like a a large amount of time for maintenance. Now, hopefully, if they are taking this large amount of time for maintenance weekly, they'll keep the website running outside of that time period. And quite frankly, that actually would be a welcome change. That was not always true in years previous. It would go down suddenly and without warning. So if this means we've got a scheduled time where the website is down, that could be, that's something that enrollment assisters and consumers can schedule around a lot easier than unexpected maintenance. But I'm not saying that that's going to happen. And I do think that advocates should continue to push for the website to be working, but also available as much as possible, given that we only have 6 weeks. There's a question here, Lydia or Zuna. This is a great question. Can the enrollment process begin before enrollment dates? So the process itself can't begin, and often we won't even be able to see the plans. But what we can say is that getting yourself ready to get enrolled is so essential. And we'll be, as part of that weekly social media amplification email, we'll be providing, as we get closer to November 1st, some detailed talking points for consumers around how to get ready. And one of the most basic things is, if you've done healthcare.gov before, go make sure you know your password and that you can log in. You only pick your insurance once a year. It's hard to remember what your password was for a website when you only get on it once a year. So making sure you can get logged in if you already have a login reduces, that is one of the things that I hear from enrollment assisters can be such a time suck. So they've got their consumer, they're ready to go, and they can't get into their accounts. And it can take a long time. So if the consumer already sort of did that prep work, that can be really useful. Also, making sure you've got your taxes filed, and that because you had to file your taxes, if you got premium assistance last year, you've got to file those taxes if you want it again this year. And then knowing who your doctors are and what your medications are, and having that list ready to go so that when you get to your enrollment appointment, you know what your healthcare needs are, so those enrollment assisters can help find a plan that meets those needs. And then we've got a great question of, what if I want to hold a sign-up event at my church? How could I do that? So I think that is something that we can work with the local enrollment organizations to get enrollment assisters out to those sites. And Kara, if you want to follow up with me via email, then we can figure out where you're located and figure out what is the closest enrollment organization that might be able to send someone out there to help you get people enrolled. And at the very least, even if you can't do the enrollments right then and there, you might be able to have an event where people get information and maybe make appointments with enrollment assisters. That's another sort of smaller version of an event. All right. It looks like I have answered all of the curated questions, and we really appreciate everyone's participation. This is a little bit more information about my organization, so feel free to check us out on the website, but please do remember to fill out the volunteer form if you're interested, and at the very least being a social media amplifier, and we will be in contact with you to get you all the resources